Tengku. My name is Tengku Nilam Baizura binti Tengku Ibrahim, and I'm from Department of Environmental Health, Faculty of Health Sciences, University Technology Mara, Cawangan Perpinang Campus Pertam. And today I will present my study with the title of Knowledge, Attitudes and Practices Towards COVID-19 among undergrad students, a quick online cross-section. So to start my presentation, this is the graphical abstract of the study, which include the tool used in the study, result and discussion, and finally the conclusion. The global outbreak of the COVID-19 pandemic affecting almost all countries and territories and its global impact has led the world to take responsive care. Lockdown, closure of commercial activities, and staying home strategies were enforced as immediate measures to flatten the curve and control the transmission of the disease. In Malaysia, government had did many actions to control COVID-19 outbreak as they want to flattening the COVID-19 epidemiological curve. On 18 March 2020, government was quickly execute nationwide movement control order to mitigate the spread of COVID-19 virus. The effectiveness of these mitigation measures is highly dependent on cooperation and compliance of all members of society. So that knowing the states of knowledge, attitude, and practices toward COVID-19 among university students and further analyzing the knowledge, attitudes, and practices factors can play vital roles in planning and confirming the countermeasures for the young generation in the COVID-19 prevention. For that, the objective of the study is to assess the knowledge, attitude, and practice towards COVID-19 among university students. The quantitative cross-sectional survey-based study have been conducted from October 2020 to December 2020 among university students during the movement control order, as it was not practicable to conduct a population-based survey during that time. So the best available method for to collect the data was through a convenience web-based survey. In total of 114 participants were from public and private university with different levels of educational background. A questionnaire was designed on the Google form with closed-ended questions, and the link was shared via WhatsApp group and Telegram. The participants who were university students in Malaysia with the age of 18 years above were eligibility criteria to participate in this survey. Each of the participants was explained the purpose of the study and required to answer a yes/no question regarding their willingness to voluntarily answer the questionnaire. The questionnaire was written in English language, and the participants were needed to spend around 15 minutes to answer all the questions given. The web-based survey relied entirely on voluntary participation from all eligible participants up to 114 valid samples successfully collected during the survey. For the result and discussion, the pie chart shows the social demographic information of the participants, which have 8 demographic variables, which are age, gender, race, religion, relationship status, level of education, program enroll, and residing state. A cross-sectional study was conducted with 114 participants aged 20 years old, with 71%, 8.8% from 19 years old, 22 years old with 2.6%, 18 years old with 1.8%, 33 years old with 1.8%, 23 and 26, and 36 years old with 0.9%, distributed as males with 16.5% and 83.5% females. The education level was distributed between diploma level and degree level with 73% and 26.1% respectively. The environmental health program participants represented the major percentage of 25.4%. So this is the result for the knowledge. most of the participants have a knowledge related to transmitter of COVID-19 virus, and 94.7% reported that the main clinical symptom of COVID-19 are fever, fatigue, dry cough, and malaria. 97% of the participants answer yes regarding of the facts that the incubation period for COVID-19 is between 2 to 14 days. 1.8% of them answered no, and 0.9% responded not sure about the question. Regarding the way of preventing the infection of COVID-19, the compliance of strict standard operating procedure SOP and avoiding the crowded places as well as taking public transportation could be used for prevention, where most of the participants reported that they agree the SOP and avoided crowded places could be used for prevention of COVID-19. For the attitude, about 98.2% of the participants hope that COVID-19 will stop quickly so that they can return to university soon, and 91% of them saw that the outbreak has impacted their study, while 8.8% of the participants do not know if they are impacted or not. Therefore, the 98% of the participants willingly to cooperate as a citizen to overcome COVID-19 outbreak. This can be related to the next question, where most of them, with the percentage of 99%, agreed that COVID-19 can affect the comfort of daily life, and only 0.9% disagreed. About 97% admitted that the media coverage such as newspaper, television, and online media gives such exposure to the news about the COVID-19 virus, and 2.6% answered no, while 93% participants thought that the outbreak will be successfully controlled, but about 6.1% reported that they do not know the fate of the outbreak. And lastly, for the practice, all participants agreed that wearing a face mask when leaving the home or in a crowded places is the best practice to avoid COVID-19 transmission. 95% of the respondents practice proper hand hygiene by frequently washing their hands with soap and using hand sanitizer, while 4.4% did not practice it. 97% of the participants avoid unnecessary travel or outing during the outbreak, and 2.6% not practicing it. About 97% participants saw that the best behavior when they noticed that they had developed the symptoms of COVID-19 is to go to the hospital as soon as possible. The result also shows that despite 90% of the participants take a shower immediately after arriving home, about 9.6% of them did not practice this prevention way. Last but not least, 98% maintain social distance during outbreak, but 1.8% only did not maintain the social distance. So for the conclusion, we can say that Malaysian university students have been inclined towards safety and good health preservation during the COVID-19 crisis. The understanding of these factors and trends may help university experts and policymakers in planning countermeasures that would control the future spread of COVID-19 among university students and Malaysian society. For that, thank you.